Here are 4 reasons researchers should consider the Ontario Health Study as a resource for accessing data and biosamples. Hi, my name is Dr. Victoria Kirsh. I'm a scientific associate with the Ontario Health Study. I'm also an epidemiologist and have used the OHS platform for my own research. The OHS was designed specifically for investigator-initiated research. Researchers use OHS data and biosamples to assess the effects of genetics, behavior, family health history, and environment on the risk of chronic diseases. It's especially ideal for early career investigators as they can get affordable, timely access to a large population-based sample that's ready-made and road-tested. The OHS platform has already supported over 58 Canadian and international research projects. The OHS enables both retrospective and prospective research. Unlike general disease or clinical cohorts, the OHS recruited participants regardless of illness or health, so researchers can follow the changes in participant health and exposures over time. The intent is to follow OHS participants both actively and passively over their lifetime, meaning the data and biosample holdings only deepen over time. Our participants remain highly engaged, even after a decade. Updated detailed health and lifestyle information is regularly collected from participants, and harmonized data sets are updated annually. Derived variables, including data generated from biologics, are returned to the cohort to further enrich the data holdings. There's a lot of really exciting work coming out of this study. In one recent study, researchers were able to detect cancer in fragments of DNA shed by tumors and circulating in the bloodstream years before the cancer would have been diagnosed by conventional methods. Other research related to the healthy aging of blood cells may uncover mechanisms related to the adverse effects of aging. The OHS is Ontario's largest biobank, and it's the largest contributing cohort to CanPath, a pan-Canadian cohort that includes 7 regional cohorts spanning all 10 provinces. We're big enough to be part of an international cohort consortium and other global initiatives. The vast majority of the study's 225,000 participants have been linked to the Ontario Cancer Registry and to ICES's data holdings, including the chronic condition cohorts that they have developed using linked data algorithms, such as diabetes, heart disease, and stroke. We can also capture lab tests, including things like COVID diagnoses, and environmental exposures, including exposure to ozone, air pollutants, nighttime light, and green spaces, as well as climate and weather. Because of these data linkages, the cohort enables research into emerging public health priorities, such as COVID-19 and the impact of climate change on health. If you're interested in learning more about how the Ontario Health Study can facilitate your research, including what's available and how to apply for access, visit ontariohealthstudy.ca.